Let's see how one punch caused two fractures in Jake Paul's jaw. On Friday night, Anthony Joshua defeated Jake Paul by knockout in the 6th round, and right after that, Paul was taken to the hospital, and later he tweeted this picture. So let's understand exactly why we're seeing two fractures here, when from a punch like this, you'd really only expect one. So here, with this punch, Paul's jaw broke. A strong right-hand punch to the left side of Paul's jaw. This punch caused a fracture at the point of impact in the mandible bone. The mandible is our jawbone, and it's shaped like an arch. It has one main weakness, and that's this angle between the ramus, the upper part of the jaw, and the body of the jaw itself, the lower part. And after a strong blow, a fracture can occur at the site of the punch or at the angle. Additionally, if the punch is strong enough, like say from a 110-kilo boxer giving you a hard punch to the jaw, the fracture itself will be so aggressive that this shearing motion will cause a fracture on the opposite side of the jaw. On the side of the punch, there's compression, on the other side there's tension, and this is called a counter fracture. And that's what happened to Paul. Here we see a CT image that shows us the fractures. On the right side of the image, which is the left side of the jaw, is the fracture created by the punch, and on the left side, the counter fracture. Immediately after the fight, Paul said he thinks he broke his jaw, and that makes sense because you can feel it. A jaw fracture is diagnosed pretty easily. First of all, we'll see an improper bite, meaning an improper closing motion of the jaw, as if the jaw isn't sitting in place. In addition, we'll see pain, obviously, and clicking when we move the jaw. Also, we might see numbness or even a lack of sensation in the lower lip or the chin. This is because of damage to the inferior alveolar nerve, the nerve that's located in that area. And then, of course, after all that, they'll do a CT scan to confirm there's a fracture. And the treatment will depend on the severity of the fracture, ranging from conservative treatment to a surgery called maxillomandibular fixation, meaning an external fixation like this for the jaw, to an ORIF. ORIF is an acronym for Open Reduction Internal Fixation, meaning opening the fracture area, entering the surgery itself, arranging the fracture fragments next to each other, and internal fixation, meaning some kind of metal and screws that hold the fractures in place. By the way, this term ORIF applies to all such surgeries, not just the jaw. And according to these images that Paul posted, this is what he underwent: internal fixation with a plate and screws. Recovery from a surgery like this is a minimum of 3 months, and usually more towards 4-5 months. The return to activity is supposed to be full. Even if there's nerve damage, it usually heals properly. In Paul's case, as you can see in the CT, the fracture is so severe that it reaches the tooth roots, which means he probably also lost some teeth and will need to get dental implants as well, which means